Hi, I'm Dr. Abhinandan Reddy. I'm a fellowship trained orthopedic spine surgeon. I'm currently director and consultant for complex spine surgery and spine deformity surgery at Asian Spine Hospitals. Kyphosis. What do you mean by kyphosis? Kyphosis is a excessive forward bending of the spine. This is a normal spine alignment when you see it from side. In kyphosis, there is excessive forward bending of a spine, so leading to the patient excessive back hump. So who get kyphosis? Kyphosis can be seen in any age group. So what are the causes of kyphosis? Kyphosis can be because of congenital defects, that is by birth. Slowly as the child grows, we see excessive forward bending of the spine, or it can be because of trauma, that is any fractures causing the spine to bend forward, or infections, especially tuberculosis of spine causing destruction of the spine leading to forward bending, or any kind of tumors which causes excessive destruction of the spine leading to forward bending. Whom do we approach when do you have a kyphosis? You generally visit a spine doctor regarding excessive bending of a spine, because this is not normal. You have to treat the underlying cause for the kyphosis. Why kyphosis detection and treatment is important? Generally, as the spine grows, the spinal cord inside the spine also grows. If spine grows excessively with forward bending, then accordingly the spinal cord also tries to grow. But at some point, the skeleton grows more than the spinal cord. So there is excessive pulling effect on the spinal cord. What happens because of this pulling effect? There is inherent pulling effect on the spinal cord because the lower nerves are fixed. This causes the weakness below the level of the kyphosis. The kyphosis can be at a cervical level, at a dorsal level, at a lumbar level. So the bending causes anything below the kyphosis a weakness. This can be presented as weakness of both the legs, difficulty in walking, or the patient may experience changes in their bowel and bladder habits like excessive constipation or overflowing bladder problems causing hesitancy, urgency, frequency and straining while going to the toilet. Which age groups are affected mostly because of this kyphosis? This depends on the condition causing kyphosis. Any trauma can cause in any age group kyphosis. Any infections, especially children, can lead to kyphosis because of tuberculosis of spine. Congenital defects in the spine, especially in children, can cause kyphosis. In the elderly, it is majorly because of osteoporosis of spine. How do we detect kyphosis? Usually the patient comes to the clinic saying excessive back hump or excessive deformity of the back causing excessive forward bending of the spine. This is cosmetic, but the patient may also complain of weakness in both the legs, imbalance during walking, or there is a change in urinary habits and defecation problems, which is because of the nerve related issues. Kyphosis, unlike scoliosis, there is a problem with the spinal cord. As you can check out my video on the scoliosis, in kyphosis there is excessive strain on the spinal cord leading to weakness in both the legs, which may be the presenting symptom when a patient visits the doctor. Is kyphosis a treatable condition? Yes, kyphosis is 100% a treatable condition. How do we treat kyphosis? So first, the doctor needs to identify the cause of the kyphosis. Is it because of any infection? Is it because of any tumor? Is it because of any trauma, or is it because of any birth defects or congenital abnormalities? So depending on the cause, we can treat kyphosis. If it is an infection, we can surgically treat the infection and give required antibiotics. Over a period of time, the alignment of spine becomes normal. If it is a trauma or a fracture causing kyphosis, treating the fracture can correct the alignment of the spine. If it is because of tumor, correcting the tumor and surgically removing the tumor can lead to straightening of spine. If it is because of congenital abnormalities, correcting the spine using a surgical procedure can lead to normal alignment of the spine. Is it a risky procedure? Yes. In a trained hands, it is never a risky procedure, but the patient should understand the risks associated with straightening of the spine. In an experienced hands, 100% the kyphosis can be corrected and brought back to normal alignment.